Okay. Hello, everybody. Welcome. Excited to have you at our Consortium for Public Health Workforce Research, webinar number 3, I think, where we're going to be talking about some very important topics, and excited to have you all here with us today about the workforce and recruitment and retention and career development. And we have 2 fantastic speakers. I'm Beth Resnick. I'm part of the consortium. I am the Assistant Dean for Public Health Practice at Johns Hopkins Bloomberg School of Public Health, but we have 2 researchers. We have Valerie Yeager from the University of Indiana, Fairbanks School of Public Health, and also Kate Beatty from East Tennessee. I'm going to let them introduce themselves. I just want to say that I'm really excited for today, and I encourage all of you to add some questions in the chat or make comments in the chat. Please put some questions in the Q&A so we can kind of make sure that we're answering your questions. I think this is a topic that we all are really interested in, and it's important for the future of our public health system, as well as our own careers and the future of the field. And what's nice about these presentations is they're actually evidence-based with real information about what's happening in health departments across our country. So we would love to hear your questions and comments, and we encourage you all to do that. So thanks for being here with us today, and I'm going to pass it to Dr. Valerie Yeager. Thank you so much, Valerie.
Thank you very much, Dr. Resnick, and I'll kick us off. And just as I get started, I want to again say I'm Valerie Yeager. I'm a professor at the Indiana University Fairbanks School of Public Health in Indianapolis, and I am a site PI for our CWORPH group. I'm presenting a study that was conducted by a large team. And so first I have given all the authors on the manuscript that we have published from this study are included on this first slide. So I want to give some attention to the co-authors because I did not do this work alone. And then separately, I'd like to acknowledge the coding team, which was a large group as well. We coded quite a lot of content that I'm going to tell you about. And so we have a large team of folks who really helped us get this work done. And as many of you know, these projects have been funded by HRSA and CDC as a part of our Consortium for Workforce Research in Public Health. So I'll start by saying that to date, when we think about workforce development, much of what we know comes from studies of people's individual perceptions of their needs. So the Public Health Workforce Interests and Needs Survey, PHWINS, asks, what are the areas where you could use more training? That's an individual perception, but what we don't know is what organizations have put into their plans. And so historically, these plans could provide us more detail about what the agencies are actually doing to meet those individual needs and their organizational needs, but these have previously not been available to us. And so the purpose of this project was to examine workforce gaps that were identified by health departments and the strategies that they plan to use to address those gaps using workforce development plans as our source of data for the very first time. So we conducted a content analysis of 201 workforce development plans from all accredited and reaccredited health departments who submitted their accreditation documents between March 2016 and November 2021. So we have 5 years of plans that were provided to the Public Health Accreditation Board as a part of accreditation requirements. Our sample represents all U.S. health departments who were accredited under the accreditation version 1.5 of the FAB standards and measures at the time that they submitted their materials. Additional inclusion and exclusion criteria are that workforce development plans that were assessed as fully or largely demonstrating that they met the intention of the requirements were the ones that we reviewed. So if a plan was submitted that needed revisions or to be resubmitted to FAB, we did not include those in our content analysis. Additionally, if a workforce development plan was submitted as a part of a multi-jurisdictional accreditation application, we excluded those as well, because those are different than what would come from a standard single organization, and we tried to have consistency in the sample. Our coding process involved reviewing a sample of workforce development plans, and we had a team of 6 of us that created a deductive coding framework. We created essentially 8 overarching workforce themes, and then within those overarching themes, we created the sub-themes that we felt were going to be identified through the review of these plans. And then as we began the process, if we found that something that we initially thought should be a sub-theme needed to be changed, or we needed to add a new sub-theme, the team was getting together routinely so that we could create any changes and employ those changes across anything that had already been coded. So as a part of our coding framework, we had an explanation for each sub-theme for each coder, and we also employed a structured training process so that every coder had the same training, the same preparation to go through these documents, which in some cases were 100 pages long. So it was quite an extensive content review. The coding team met bi-weekly to discuss any codes that needed clarification or resolve any concerns that people had about content that they were trying to code. And we used group consensus to meet those, to make those decisions. At the end of the coding process, a data quality check was employed by one of the coders who coded a large portion of the documents, and to ensure that we had consistency across the coding and the content. And for anyone who's interested, we used Deduce as the software that we employed for coding. So to help folks understand what I'm going to present from our findings, it's important to understand these 3 categories of what we coded. So we looked for whether or not an agency identified one of the sub-themes as a gap. So if they said they had a weakness in an area or a shortcoming, or they used the word need or gap, we identified and coded that section as a gap according to the sub-theme that it was appropriate for. If that same sub-theme, they mentioned that they would like to do something about that gap. So they mentioned that it's their aim or their objective, or they're going to set a goal to resolve that gap. We thought of that as an intention, meaning that that's something they want to work towards. But if they were specific about their intention and actually outlined their approach, so they gave us the strategy they were going to employ to try to meet that gap, we additionally coded that section as a strategy. So for a particular sub-theme for the same organization, they could be coded for that sub-theme as having identified a gap, setting an intention, and setting a strategy. But in some cases, for a particular sub-theme, they just mentioned a gap and neither of the other 2. Or they just mentioned a strategy towards something that they never mentioned was a need or a gap. So I'll give you an example. This is one of our sub-themes. It's called Establish a Learning or an Innovation Organizational Culture. As an example text where an organization said they had a gap, they said, during the assessment process, it was revealed that there was a need for developing and endorsing a positive learning culture. This one's very clearly identification of a gap. For their intention, for another organization, example could be develop a learning culture that encourages and supports training, continuing education, professional development for health department staff. That's an intention, but it's not specific about how they're going to go about it. Another organization could put this we have strategy 1, identify leadership and staff professional development opportunities, deliver trainings, provide one-day content-related trainings quarterly for employees for specific divisions. So there's variation in how they can talk about establishing a learning, innovation, organization, and culture. And we were trying to see what types of gaps agencies were telling us that they had, but also what strategies were they employing, and are there any areas where agencies might need support to identify the right strategies or support them in applying those. So here are some of the findings. And I want to note that we have published this study and it is available open access, and I believe we'll put the link to that in the chat at some point during our presentation today. But I'm giving an overview of the findings, given that there were 8 themes with many sub-themes. The table of how many organizations and what % of our sample had gaps, intentions, and strategies is just simply too big to share in a presentation like this. So I've synthesized it into the top 10 sub-themes. And if something is listed as a 1, that's the most common sub-theme within the categories of gap, intention, and strategy. So what you're looking at here are the top 10 gaps, the top 10 intentions, and the top 10 strategies. And we're going to dig in on these numbers in the next couple slides. So the first thing I want to point out is that 3 of these sub-themes were within the top 10 across all 3, meaning that is really common for agencies to identify this as a gap, to mention that they're going to work on it, and then to offer up some strategies. So these include, within delivery of trainings, provide basic technology and informatics skills training. Within organizational culture, foster quality improvement and provide QI training. And then within the theme of partnerships, prepare the workforce for community engagement and partnerships. The next thing I want to note is that there were a number of sub-themes that were identified as a gap, and in some instances noted as something they'd like to work on, but rarely had accompanying strategies. These might be opportunities for supporting agencies in identifying appropriate strategies. So the first is within training around resources and funding training, or being able to resource or fund training is a gap, something they'd like to solve, but not something they have solutions for. Within the delivery of training, we've got training and support for budget and financial operations, train on or improve systems thinking and or strategic planning, and teach data-driven decision-making. All 3 of those were a gap, but they were rarely identified as something they were intending to work on or a strategy that they had already identified. And then within organizational culture, strengthen organizational and internal, specifically inclusion, diversity, cultural sensitivity, and equity. And under leadership, succession planning. Both of those were gaps with noted intentions, but rarely accompanying strategies. On the flip side, there are a number of things that were identified as strategies, and the top 2 strategies that we saw in the workforce development plans were assess training needs, which is a big part of developing a workforce development plan, and foster quality improvement culture and provide QI training, which we have seen as a goal of agencies for some time. And so that's something that's probably underway already in a lot of agencies. And so it's one that they have strategies for often. But these 3, which includes assess training needs, it's a strategy, but it's not identified along with incorporate continuing education in policies and processes, and forecast workforce needs, capacity, or workforce planning, were all strategies that we found in their documents, but they didn't have accompanying needs or gaps that went with them. So one thing I want to point out, what you didn't see in those tables is that sub-themes within recruitment and workforce support or workforce retention were infrequently reported as gaps, which is surprising for those of us that study workforce recruitment and retention, because this is often highlighted as one of the most pressing needs for public health agencies in our current times, but it's rarely reflected in these workforce development plans. And in particular, increase recruitment diversity or recruit from a more diverse applicant pool was rarely identified as a gap. Only about 6% of the plans included that as a gap, and it rarely had a strategy for addressing it. So about 9% had that strategy included in their report. Another note from this is that we coded each plan based on what they said they used as a competency framework for developing their plan. And this is important, I think, because these frameworks actually probably provide the guide for them of what to include. And so while we're thinking critically about what's in the plan and what's missing from the plan, something we also might need to reflect on is if these competency frameworks are what are guiding them, then we may want to think about how we help agencies to start focusing on recruitment and retention in their workforce development plans going forward, if indeed it's not in these types of competency frameworks. And then as my last slide, I have a couple discussion points. So I'll start by talking again about many health departments recognized workforce gaps, but they didn't always have appropriate strategies for addressing them. And conversely, some strategies were mentioned where they didn't necessarily recognize, they didn't match a recognized gap. So health departments may need some technical support or technical assistance to identify and develop plans that address their gaps, and especially those where they're missing clear strategies. Recruitment seems to be an overlooked topic within these plans, which is an important component of workforce development. And both version 1.5 and the latest version of the FAB accreditation standards, version 2022, include a measure where recruitment is the focus. It may be beneficial to explicitly discuss recruitment in that measure so that agencies give more attention to it in their planning. And then a last point, recent investments in infrastructure and workforce, such as CDC's recent $3.2 billion in the FIG grants, offer an opportunity to better support health departments in addressing their workforce development needs and their gaps. So it's exciting to have some information reflecting on these workforce development plans. And it's not meant to be a criticism of the health departments and what they've done, but it's meant to give us some information that we can support them in making these plans as meaningful as possible to their agencies. That's all I have. Thank you, everyone.
Great, thank you so much. Interesting presentation. There is one thoughtful question that I'm just going to share now, and I think we could all think about because I think this is the point of the whole webinar. So whoever asked this question, thank you, was like, why don't we think there was recruitment in those workforce development plans? And I think that's an excellent question to really think about. And then our next presenter is also going to be highlighting about not only recruitment, but also once they're there, right? Are there going to be pathways for promotion and advancement? So please continue to put questions in the chat. In the Q&A, your questions, so we're sure that we answer them. Any comments or things, and thank you. I think Ashlyn posted the paper that Valerie, the work that Dr. Yeager just presented. I'll post it again, actually, once we get into the second presentation in case somebody jumped on late. So thank you, and I'm going to pass it to Dr. Beatty. Thank you.
Good afternoon, everyone. Let me get my slides up and start the presentation. Are you seeing, Beth, are you seeing the right slides or the notes?
We're seeing both your notes and the slides.
Is that better?
Now, oh, right, I'm in the presenter mode. Now I'm just seeing the slides now, the present.
Thanks. All right. So as Beth mentioned, my name is Kate Beatty. I'm an associate professor in the College of Public Health at East Tennessee State University, and I'm a member of our team at the Center for Rural Health Research, which supports the CWORPH project. And today I'm going to be talking to you about the project that that we led around exploring the use of career ladders to recruit and retain a diverse public health workforce. And similar to Valerie, we had a great team that worked together on this project. The reason we're presenting together is because really the work that we did on this project couldn't have happened without all the hard work that Valerie just described, that her and our team did to code and theme out the workforce development plan. So we really thank them for that. And again, this is funded through the same funding as the other CWORPH projects. All right, so to piggyback off of our conversation about recruitment and retention, governmental public health workforce has traditionally faced a variety of recruiting and retention retention challenges. These include an aging workforce, high turnover rates, lower compensation, slower hiring processes, and a decrease in public funding. We know that there's an increase right now, but often we're kind of in these feast or famine places in governmental public health. And the pandemic really stressed an already burdened system. So these challenges were existing before, during, and continue to challenge public health. And these challenges impact public health's ability to maintain a robust and diverse staff capable of delivering the essential public health services. So one option that we are exploring is the use of career ladders. They may provide an opportunity for these entry-level employees to gain knowledge and skills needed to advance from intermediary to leadership positions within their agency. They're considered a series of official steps within a job classification, which increase in responsibility and required expertise with each step. Through career ladders, workers have a formal path like education, certification, and performance requirements to follow to advance to the next level. Often career ladder programs partner with local higher education institutions like colleges, universities, and training organizations to provide the necessary education for employees to advance. So in short, career ladders may help agencies recruit, grow, and retain knowledgeable staff to improve employees' wages and job satisfaction. Another term, and we'll talk a little bit about how they're used separately and interchangeably, is this idea of succession planning. Succession planning is a way for organizations to identify critical leadership and management positions and develop staff to assume those positions. This may alleviate some growing leadership vacancies due to retirement and high turnover. And it may also help workplace diversity by offering pathways to leadership for individuals who may have otherwise lacked the necessary education, training, and mentorship. So despite the aging workforce, COVID-19 departures, and high turnover rates in the public health workforce, highlighting an immediate need for managing leadership transitions, few public health agencies engage in formal succession planning. So the purpose of the study is that there's little is known about if and how governmental public health agencies implement career ladders and succession planning, nor how they may impact their ability to recruit and retain a diverse workforce. So this study examined how public health leaders define and utilize career ladders and succession planning, and facilitators and barriers to that use. So this study used kind of an exploratory mixed methods, and so that included document review and semi-structured interviews. To qualitatively assess those workforce development plans submitted to FAB, the work of, I'll just briefly mention because Valerie did a wonderful job discussing this, but the workforce development plans were coded. This included workforce development plans that were collected between March 2016 and November 2021. Those included, again, 168 initial accreditation plans and 33 re-accreditation plans. And so within that, their team of 11 coders reviewed and extract information from those plans. And so for this study, 39 health departments were identified and described their career ladder and or succession planning in one of the following ways. As she mentioned, a gap in their workforce development plan, a strategy that they included in their plan, or that they intended to explore career ladders and succession planning in the future. So then our team used these, pulled these 39 and reviewed the workforce development plans to really get an understanding of how they were talking about succession planning and career ladders. And from that, 26 were identified as either using or intending to use in the future. And so again, out of all of those workforce development plans that we originally had, around 200, only about 26 were using or intended to use in the future. We invited all of those health departments to participate in the study, and ultimately 10 health departments were recruited to be interviewed. And so we used key informant interviews with these 10 local and state health departments across the US. We used a rapid coding process with double coding of all interviews, and then we pulled out the thematic coding, did thematic coding of the interviews and pulled out themes regarding their use as a strategy for recruitment and retention, as well as other themes that emerged. So these interviews were conducted between June 2023 and August 2023 with health department representatives. Interviews were conducted with 14 participants representing 10 health departments. So some interviews included more than one person based on kind of who they thought should be at the table. Most of the interviews were conducted with county or city-county health departments, which was about 7, while 3 interviews were with state health department personnel. Health departments represented most of the regions of the United States and all major governance structures. All participants were at the director, deputy director, supervisor, manager, or coordinator level and had a role in the hiring process. Some were responsible for hiring at the state level, and some state representatives were responsible for informing policies at local health departments that they utilized to fill vacancies. Local health department respondents were either responsible for hiring their direct reports or in general for signing off on hiring processes conducted by staff. So this is what our sample kind of looked like. All right, some results. So we kind of started with just asking them about what was going on with recruitment and retention now. And as you can imagine, they identified many challenges to recruitment and retention. Some of these included difficulties finding qualified candidates, especially for more specialized roles, limited funding, and not being competitive in terms of wages compared to the private sector. And then they talked quite a bit about hiring processes and restrictive practices, which will come up in additional themes. When we asked about their work to recruit and retain and grow a diverse workforce, they described being more creative in advertising positions using a variety of venues, including social media, Indeed, LinkedIn, maybe more traditional like their website, to attract a more diverse pool of applicants. But then they kind of counter that with that they were recruiting a diverse pool, but job requirements and scoring processes are often really restrictive, and that could actually lessen diversity and attempts to be less biased and based on some policies. So we wanted them to kind of describe to us what career ladder and succession planning meant. And when they talked about career ladders, they primarily operationalized it as an internal process for current employees to improve staff position and salaries through that increased education and responsibility. They mentioned leadership training, kind of co-occurring with career ladders and the idea of succession planning. And some did identify succession planning as part of career ladders, while others viewed it as a different strategy altogether. We asked them about the effectiveness of their career ladders for those who were using it. And they described the effectiveness through primarily job satisfaction, professional development, and ultimately in retention of those folks. It was not brought up and utilized often for recruitment, but really, again, kind of thinking of it with the current staff that they had. And a few health departments were fairly early in their process and reported they had not seen an impact from career ladders just yet. So we asked them, what are some of the challenges for governmental public health to implement career ladders? One of the challenges are limited growth paths, or not so many rungs on those ladders. And so this respondent said, we recognize that we've lost very good employees just because they realize that the ceiling is here. At this time, we don't have a lot of turnover in our leadership roles either. So kind of speaking to both those things, like there's not a lot of steps and there's not a lot of opportunities to move into those leadership roles. Financial and promotional balance. So this idea of balancing financial stability with promotions was a key challenge. So even if people, managers saw that they wanted to promote their staff, there's just limited resources, and they were really identifying that funding is a real challenge to kind of develop those career ladders. A challenge brought up multiple times was this specialized role fulfillment. These challenges where even if you know, say a nutritionist is leaving, you cannot post the position until they've left, and then the process is slow. So really being challenged by quickly filling specialized roles upon vacancy. So kind of two phases where it's hard to find the candidates, as they mentioned, and then the process makes it slow. Another challenge was regulatory and hiring misalignment. And so the differences in their desires and what they want to do around hiring, be it move someone already within their staff up, or someone who may have a non-traditional background, they were really challenged by the regulations around the civil service. So that can really hinder their ability to develop formal career ladders. And then there's inefficiencies in that hiring process. A couple of them mentioned diversity, equity, and inclusion challenges. And these challenges in promoting this coupled with recruitment difficulties due to funding and process complexities, really got in the way of their intention to have a workforce that represented and looked like the communities that they served. So one more quote around these challenges that I think illustrates what our governmental public health folks are going through. It takes forever. We have to do all these things before we can post that. We finally post it, and then we get these applicants. Then there's a long process to be able to even get to the interview part. Then once they're interviewed, there's a long process. People don't hear, they think they weren't selected, they're over and done. By the time we make them an offer, they've accepted another position. It could be 3 months later and they found a position and got hired before we can grab them. And so this was one of our local health department respondents. So we wanted to kind of identify some strategies, right? So here's some challenges, but what are some strategies? And so this idea of a tailored ladder for professional growth. So customizing the ladders for public health professionals, addressing educational requirements through smaller incremental steps. So really, kind of informalizing some of the process to focus in on the needs and professionally for your individual staff. This idea of incremental leadership responsibility. So in the face of the realities of funding and kind of challenge with promotion is providing staff with formal leadership roles, with more leadership duties to foster skill development and career progression. So maybe allow someone to lead more activities to help grow those leadership skills while they're in their same position. One of the challenges that came up with recruiting, in addition to the ones I mentioned, was that the workforce is changing and wants to have kind of more flexible work. So some health departments were able to do this. So they had adopted more competitive measures, including innovative policies like remote work to attract and retain staff. So really trying to address this issue of trying to recruit within the bounds of funding, but making maybe the job a little bit more flexible. Some health departments had looked at reconfiguring the organizational structure, and so had started developing those more stepping stones for advancement or adding rungs to the career ladder for smoother progression. So identifying maybe assistant position and just allowing people to have more stepstones along the way. And then a couple of the health departments felt like the idea of a career ladder was a little bit kind of rigid, that you have to go up on this one path. So kind of moving away and being more flexible and adaptable to focus on those employees' interests and embrace that flexibility, fostering. One of them really talked about a career web. And some called it bridges to other places within the organization. So just starting to be more flexible and adaptive. So my last slide, just a discussion before we open it up, is health departments have challenges with recruiting and retaining before, during, and following the pandemic. They identified career ladder as supportive for retention rather than a recruitment tool. Health departments want a diverse workforce that was reflective of their communities. Many talked about how they were assessing the what their staff looked like compared to their communities, and really were they knew they needed to make movements around diversity. But complex recruitment procedures can lead to inadvertently passing over diverse candidates while attempting to limit bias in the process of applicant selection. And again, those challenges included for implementing career ladders and succession planning, limited funding, rigid and prescriptive processes, and formal hiring processes required by the state and local government. Right. And then thank you.
Great, thanks to you both. Such interesting presentations, chock full of things. So we have a number of questions. A few of them are more broad, so I'd like to hold those and maybe answer those more holistically. There's one about why recruitment was barely mentioned. And the second one was about what do we think about pre-COVID versus post-COVID. So I think those are broad questions. So the two more detailed ones that maybe we'll start, and again, attendees, please continue to put in, these are very thoughtful questions. Dr. Yeager, the first one is for you about the, this is a great question. I know I've had questions about this myself too. Who in the health department is responsible for moving the types of strategies forward that were in these plans? And is there something about separating basically the workforce team from human resources within a health department? And they're basically looking to see if there's anything in the data given like workforce being separated from the financial or the HR. So basically HR versus the workforce team, and how did that divide up?
Thanks. We didn't actually, sorry, I had a technology delay. We didn't actually have collect data on what workforce teams look like within these health departments. From my experience talking to practitioners and hiring managers, I think it really differs by the organization, and it has a lot to do with the size and the human resource capacities of the organization. So some of these organizations are small, and that might mean that they don't have an HR director, and they likely don't have a team that's dedicated to workforce development. As agencies get bigger and they have HR directors, they may have a team that works with that HR director, but we haven't collected data on what workforce development teams look like. So I can't really answer it in an easy and straightforward way. I know there are people on this webinar who probably are HR directors or who sit on some of these teams. So if those folks want to add to the chat and share some of their experiences, it certainly could be something that we could all benefit from. But we are doing more qualitative work in this area. To some of the points that Dr. Beatty brought up in her presentation about the restrictions regarding desires versus what civil service requirements or restrictions exist. We're looking at some of that this year in some of our current projects, and we'll be talking to HR directors about that. So that's something that we will continue to explore. I don't necessarily have any recommendations on what the best practices are for who leads this work. Dr. Beatty, I don't know if that came up in any of your conversations about how to structure this.
So I just want to point out that as this consortium, we all have year 2 projects, and I'm actually going to be building on some of this work too. So please keep these questions coming, because as Dr. Yeager said, we're going to be doing more qualitative work. So for example, the size or who's on your workforce team would be a super important thing to contribute. So I appreciate these questions. They're really important. So Dr. Beatty, the next question was specific to you about the career ladders. Was there a specific level of employment that it was used? And I guess they were asking in particular, was this just more for executive staff, or did they not clarify that, or what kinds of levels of staff were they looking?
So at least one example was someone who was clerical staff who had been working at the health department, kind of in the front office desk, and they supported that individual to get public health training. And then they moved into a health educator position. So really, one of the interviewees was talking about how we should really promote that there is opportunity in the health department for movement, regardless of where you start. And we know from some previous work, especially with rural health departments, you may have a nurse who's working in WIC, and 20 years later, she is the administrator of the health department. And so these opportunities to move up and the educational, they weren't really talking about it as specifically around executives or like higher level folks. They did talk about that more with challenges, with a lot of turnover. And this is not surprising with health department directors across the nation, and like during COVID and shortly after, folks leaving and having a hard time identifying folks to fill those positions, in addition to those civil servant requirements where things have to be posted, and you can't necessarily pinpoint always the person you want to put into that position. So just a lot of challenges with that succession planning, which kind of sat more in that conversation of the higher level of folks. But good question.
So just building on that, thank you guys. Great questions coming in here. Dr. Beatty, somebody also had another question about the career ladders. If anyone highlighted the community health worker as a role?
That did not come up specifically. Quite a bit about nutritionists and nurses. Well, health educators more so than community health workers, but I think that's a great thing to discuss, because community health workers, I think, is a topic ripe for exploring.
Great. Yeah, thank you. Okay, then there was, I think I can combine sort of two of these. There was something in the chat about examples of recruitment or retention plans, and I know it's always nice to have best models and things. So that's another important point. And then there was also another question about their workforce development planning documents with non-accredited health departments. So maybe Dr. Yeager, you can start us with those.
Sure. To the first question about example workforce development plans, I want to just say that these plans are submitted to FAB in a confidential manner, that FAB won't distribute them widely. So we have a data sharing agreement with FAB that we're looking at these, but we're not presenting them in any way that the agencies or their locations or their states would be identifiable in any of our work. So with that in mind, we're actually not allowed to share them with others, but I know FAB's website does have some examples that agencies that are planning for accreditation can model off of. I haven't looked at those myself, so I don't know how detailed they are, but I think that's where I would start. Many agencies would probably be willing to share their workforce development plans if they were approached by another public health agency looking for guidance, but we don't, as the researchers, have the ability to share the examples.
So sorry, I think I misspoke, Dr. Yeager, apologies. I think the question was more about the recruitment and retention plan specifically, so not necessarily the whole workforce development plan, but you raised.
Oh, I see, to add that into workforce.
Yeah, like a
Sorry,
separate thing.
understood.
And then there was also an example of, I guess, Dr. Beatty, this one will be for you, if there's also examples of these public health career ladders. So again, it was a recruitment and retention plan specifically.
Yeah, I don't have a section that is a best practice section for recruitment and retention. But it's certainly something that we could put our heads together with NACCHO, ASTO, and FAB to talk about what that should look like and what should be contained in it. I mean, first and foremost, thinking through, how are you recruiting? What are your mechanisms for recruiting? Is there anything you can do to address the barriers that stand in the way of your recruitment? Even just talking about and acknowledging how long it takes to hire someone. So many of these plans do not track time to hire. And there are different ways to measure time to hire, from identifying that you need a position and then going through the process to get approvals and what the hiring committee is going to look like and the criteria, or the time from posting to having someone sit in that chair. And all of that technically is how long it takes to hire. But many agencies don't track that at all. So you don't have something to benchmark yourselves against as whether or not you're doing some type of quality improvement process to shorten the time to hire, or collecting feedback from people about the hiring experience. How can we improve the hiring experience Is that, which from anecdotal reports, is where lots of good candidates drop out, is because of how long it takes or what the experience is like. So those types of things are missing from the needs and the gaps and the, how are we going to resolve our recruitment issues? So I think that's some of what we're thinking about in what could be included in the workforce development plan, but we innately tend to think about the people we already have on our team. How do we develop people who we already have here versus thinking in a more broad approach of how do we get the people in and what are the options that we have? Or does it require actually a bigger change in our state and, changes in the hiring approval process?
Great answers, and thank you for these questions because you're helping us formulate our year 3 projects. So this is terrific. So I think I want to get to the big picture questions, and then Dr. Beatty, maybe you could just put in the chat if there was any examples for the public health career ladders specifically. But the bigger picture questions, the first one I think, and Dr. Yeager, you were just sort of getting at this about why do we think there isn't recruitment involved in embedded into these workforce development plans for the most part?
I talked a little bit about the competency frameworks. I think a lot of agencies lean on competency frameworks to develop their plans. And so it may be that there's not a big focus on recruitment in competency frameworks. It may also be that, examples that have been provided to agencies don't have that in there, so they don't think to put it in there themselves. If there were tools to support agencies in thinking more broadly about recruitment and addressing recruitment barriers, maybe that would be more common in workforce development plans. And I want to just mention that as a part of the public health infrastructure grants, the FIG grants, those require that there's a dedicated process to workforce recruitment. Many agencies are now specifically hiring workforce hiring managers or workforce directors. And so there's a lot of work underway to make improvements to this, which many agencies that didn't have a workforce development plan or who haven't gone through the accreditation process are not reflected in our data. And so there's an opportunity to learn from what's going on with the FIG process that would be more generalizable to agencies across the nation rather than just those that are accredited. So we are probably going to see changes specifically because of the funding and the directives that have come with the funding of what agencies should be really focusing on.
Great, thank you. And then there was another general question about COVID. Obviously, these were pre-COVID. Do you think they would have been different in if it was post-COVID? And were you able to do any analysis like that with what the data you had?
We weren't able to do that analysis because our plans stop in 2021. So the plans that we might have had a plan or two that got submitted during the COVID experience, but it would have been a very small portion of the plans that came in. As you know, most agencies had shifted their attention to responding. It's certainly something that any new plans would reflect. And maybe plans are now going to have more of a focus on emergency response training and workforce development as it pertains to the types of things that were asked of employees during, our COVID outbreak.
Great, thanks. And the question about career ladders, Dr. Beatty had put in the chat there about what they were able to see. There was another question about the new AmeriCorps Public Health Corps program is helping with the needed public health workforce, but is there any data on success in that?
I don't particularly have any insights. I know some of our colleagues in CWORPH are working on this, and so I think it's TBD. There's probably some presentations that will be forthcoming that would speak more to the AmeriCorps program.
Okay, then somebody had a point about that there might be a lot of puffery when it comes to these plans that are submitted for accreditation. So I guess was there research or verification about what was actually done by these departments versus what was self-reported? Was this all self-reported in the accreditation?
So to some extent, Dr. Beatty's work was trying to do that. If they said they were doing certain strategies, she wanted to talk to them about that. And Dr. Resnick, I know some of the work that you're doing this year is kind of that validation. If you had a strategy in a certain area around diversity and equity or those types of things, well, how did it go? Were you able to execute those strategies? Did you see any changes? Even if it's just perceived changes, what were your experiences? Is there anything others could learn? And so we're in phase 2 of trying to learn more about, whether or not it was just wish list strategies or things that people are actually and agencies are actually able to be working on.
So I know we're coming to the close of our hour. I want to really thank the people for the presenters, of course. Thank you and CWORPH for hosting this, but thank you for these great questions. I think you're really helping us formulate our future projects, and clearly there's a need for better narratives, and there's another question about what happens with implementation and outcomes, and I think these are questions we all want, and with the public health infrastructure grants, they're going to be even more important. So we look forward to doing another one next year, where hopefully another webinar where we could give you more details, and we really appreciate it. And thank you to University of Minnesota and CWORPH for hosting this. So thanks everybody. Have a great afternoon, and thanks again.